I thought one thing you said was quite interesting today, and that is the moral burden. Okay,
Yes.
I want to drill down. What does that mean? Give me an example of a moral burden that the nurse would have.
Sure. One of the surveys that we did at the American Nurses Association with the foundation is one of the major issues that nurses face every day is that they're unable to provide their patients the care that they deserve. They see themselves in their patients, and at the end of a long shift, because of all that's required of a nurse, it's almost impossible to meet all the needs that have to be met. So because of that, you leave with this thinking that, oh, I forgot to do this, oh, I could have done that. I could have, and the biggest issue really is, I wish I was able to spend more time with my patients to get to know them. And that's unfortunately more the case than not, because somehow we've unintentionally created a care delivery system where nurses spend less time with their patients. And spending time with your patients is really where the joy is in nursing. And we're all consumers too, we see it. Even though we're also care providers, we see what it looks like when we're on the other side. When we're in healthcare settings for ourselves or our loved ones, we see that the eye contact that we desire is more tilted towards the computers and paperwork. And that's where you see a lot of the moral burden come out, where I wish I could have done more. My patients deserve more. I'm better than this, but
Right.
I'm not able to do what I'm supposed to do.
Wow, that's interesting. And one of the things I have heard quite a bit is an emphasis over the past few years on staffing ratios. And then I've also heard, okay, well, it's not about the staffing ratios as it is resources in terms of nurses working at the top of their license because they're having to do things that maybe some of the support staff could do. So what do you think it is in terms of what should organizations be focusing more on? Is it the staffing ratio itself? Is it providing more resources for the nurses to work at the top of their license? Is it something else? What are your thoughts on that?
So you're touching on one of the touchiest, more polarizing topics in nursing, ratios. And actually, I'll say in the acute care setting. So I'm going to try to unpack this because I work for the American Nurses Association and we support ratios. But when we say that, we're not saying that's a be-all, end-all, because we do believe that it is foundational. No matter who you are and what you do, if you happen to be a nurse at any point in your life or give care at any point in your life and you're given an assignment, of course you're going to want to know how many patients you have compared to the next guy and what that means in terms of being able to provide adequate care.